So, what is keratoconus? And what are the best treatments for keratoconus? Well, in this video, we're going to be going over just that. Plus, we're going to include some tools that'll actually help you find a specialist in your area to get help, as well as some tools that'll help you navigate with insurance to help you get the treatment you need. So, in this video, again, we're going to be covering all of that. If this is the first time you're here, I am Dr. Joseph Allen, and I'm the host here on Dr. Eye Health. The channel helps you with the eyes, vision, and finding the best vision products. So yeah, if you're new here, you like learning all about the eyes, vision products, then you're in the right place. And please go ahead and hit that like button and subscribe so you don't miss any of my future videos. Now, again, in this video, we're covering keratoconus, which is a disease of the cornea, the front surface of the eye. Now, if you've never heard of keratoconus, we're going to be covering just that. If you just like learning all about the eyes, then perfect. Otherwise, if you're here catching it on the replay, then you've probably either been diagnosed with keratoconus yourself, or maybe a family member of yours has keratoconus and you want to learn more about it, and that is perfect. So keratoconus is actually a disease of the surface of the eye, and that is where the front surface, called the cornea, and I'm going to go ahead and show that to you here. The front surface of the eye, of the eyeball here, the front surface is called the cornea. Now, the cornea here is the clear part. It's like the clear window to the eye that you see out of. But the problem with keratoconus is that actually, let me see here. The front surface has the central part called the stroma. Now, the stroma actually begins to degrade over time, and it actually begins to then thin. So when that happens, the thinning of the front part of the eye, the cornea, begins to thin, and then it actually begins to bulge out and change shape and forms the shape of a cone. So that's why we call it keratoconus. So that's pretty easy to remember, right? So with keratoconus, again, we have another kind of diagram I can show you here, what it kind of looks like. So in a normal eye here, this is from the National Eye Institute, the normal eye has the front surface, which is pretty round. But in keratoconus cornea is, again, bulging out, forming the shape of a cone, and it actually is thinning. So that's basically what keratoconus is. Now, if you're somebody who has keratoconus, or have never really know too much about it, keratoconus is actually a bilateral disease. It happens in both eyes. However, it's most likely asymmetric. So most people, it'll be more advanced in one eye than the other, but it generally does present in both eyes. Now, some people can have really mild keratoconus that's not really affecting their vision. They can usually just continue with glasses, regular kind of soft contact lenses, but people who get really advanced, moderate to advanced keratoconus, they have significant visual issues. They actually have really irregular astigmatism. And if you've never heard that word astigmatism before, maybe you have in your exam, but you're not sure what it means, I do have another video covering astigmatism, and you can check that out. I'll hook it up here in the YouTube card above, as well as in the description below. But astigmatism can cause a really distorted vision. So people with really moderate and advanced levels of keratoconus will end up having excessive amounts of kind of warpage in their vision, and that could significantly affect their visual acuity. So they may have difficulty learning in school. If you're in your teenage years trying to actually study and do well in school, it's going to make it tough. Same thing if you're trying to drive or you're trying to get to work. It can significantly affect your vision. Now, in the exam room, most doctors, a lot of times if it's really mild keratoconus, they may not detect it right away, but as it continues to advance, they can start to pick it up. And in a lot of our clinics, like the clinic I have here in Minnesota where I practice, we actually have a couple of devices that help us scan the surface of the eye, and we can detect keratoconus even in early stages. So I can kind of show you a picture of what that would look like. This is actually called a topographer, and it uses what's called Placido disc technology. And this topographer actually maps out the front surface of the eye, kind of like if you were flying over a mountain. If you were flying over a mountain in a plane and we're looking down and you were able to map out the steepness of the mountain, that's kind of what we're looking at here. And so in that case, we can detect keratoconus pretty easily, and we can actually monitor it over time to see how it's advancing. Now, again, keratoconus is a progressive disease. So even if you have it really mildly early on in life, it usually progresses. Actually, the earliest age I think I could find in literature that was recorded for someone developing keratoconus was at age 4. So kids and teenagers usually end up getting this. There are a couple other variants of keratoconus that can appear later in life. But yes, it is something that a lot of people can get. In fact, if you're somebody who has keratoconus, I know this is actually something that's been requested by a lot of my viewers is for me to review this topic. If you're somebody who has keratoconus, if either you're in the chat or you're catching this on the replay, go and comment. Let me know. How long have you had keratoconus? Is it getting worse? Is it stable? Have you had any treatment for it? Now, believe it or not, there's actually quite a few people with keratoconus. So some of the older statistics have said that it's estimated 1 out of every 2,000 people have keratoconus. But that was actually from a study in 1986. And now they actually have some updated numbers from 2017 that said that they're looking at health insurance claims, and there was 1 out of 375 people. That's quite a bit of people. I mean, I grew up in a smaller town, well, not a pretty medium-sized town of like 67,000 people. We had 3 high schools, and my high school had 400 graduating students. That's like 1 person out of my entire graduating class had keratoconus. That's actually a pretty common number, and that's reflected in even in the clinic where I work. We see keratoconus quite a few times throughout the year. Now, a big thing for anybody who's watching, and again, you've heard keratoconus, or maybe it's in a family member, and you're not sure, what exactly causes keratoconus. It's actually it's kind of an enzyme degradation of the corneal fibers. The collagen fibers of the cornea get degraded, and that causes them to thin and weaken. One kind of pro tip for everybody who has keratoconus or somebody who has really bad allergies of the eyes is eye rubbing. So you've probably heard at some point your doctor says, don't rub on the eye really hard. And the whole idea is that when you rub really hard on your eye, you actually cause really kind of like these micro damages to the collagen fibers of the eye. And when you cause the damage to the cornea there, then those enzymes try to repair the damaged tissue, and it actually ends up causing it to get worse. So people who rub their eye really badly and they have keratoconus may actually cause keratoconus to advance even faster. So yeah, if you've got keratoconus, try your best to stop rubbing your eye. If you have bad allergies or something like that, talk to your doctor about your allergies. See if they can get you on oral medications or eye drops or something that you can do to help control the itching and irritation. But now that we've kind of gone over more about keratoconus and exactly what it is, let's go over the treatments of keratoconus. Now this is big. Now the first one that we're going to go over, I really want people to listen to, again, if you have keratoconus, and that one is going to be what's called corneal crosslinking. So corneal crosslinking was approved in the United States here in 2016. It had been out much longer out in Europe and in Canada, but it's actually a process where they use riboflavin, which is vitamin B2, and then they use ultraviolet light, UVA specifically, to actually activate some cells on the surface of the eye and get them to strengthen. And this is really kind of a revolutionary treatment, especially for keratoconus, because again, keratoconus is a progressive disease. It actually gets worse over time, but with corneal crosslinking, you can basically stop it, or at least slow it down from getting worse. So this is basically kind of the first thing that comes to mind when I have somebody who's got keratoconus. We usually follow them for at least 6 months to kind of see, hey, is this something that's progressing? If it's progressing, immediately we start talking about corneal crosslinking, and we start getting them referred over to see the specialist. So corneal crosslinking is done by a corneal specialist. This is your ophthalmologist. There's, every state usually has a couple of them. Sometimes you do have to drive a little bit to go see them because they have to be doing this procedure. They have to know how it works, how to do it. And here in Minnesota, there's a couple of really good surgeons that I know that I refer all my patients to if they need this sort of treatment. And they've actually been involved with the FDA approval back in 2016 for doing this procedure. Now, again, I kind of threw in the picture here of a woman wearing a knit sweater, because that's how I think about it. The front surface of the eye, if it's pretty weak with keratoconus, again, it's going to bulge and thin out. But cross-linking, you can think of it as if you took a knit sweater and how it stretches and it's kind of weak. If you dump that into a bucket of glue, like epoxy glue, and then you shined UV light on it, and that caused the epoxy to strengthen and stiffen. So again, that's exactly how this process of cross-linking works. They actually put riboflavin, the vitamin B2. It's a certain mixture. It's not just pure riboflavin. Certainly don't ever do this on your own at home, but it's actually a specific mixture. It's actually a medication that's put on the eye, and then they shine the UV light on it, and that causes the collagen fibers to stiffen and strengthen. And that actually has been really just proven over the last couple of years to really help people with keratoconus, as well as potentially a treatment for people with ectasia or people who have had issues with warpage on the cornea after having some type of failed surgery, such as a LASIK procedure that didn't go well. So that's the big thing. Corneal crosslinking. I want everybody that has keratoconus that's watching this video to look up corneal crosslinking. And in fact, if you've not really sure, if you have keratoconus, how do you contact somebody? Where do you find your corneal specialist? There's actually a couple tools I'll hook up in the description below, but I want to show you one of them. This is called Avedro, and it's from a company that actually has a search engine where you can just type in your location and it'll highlight corneal specialists that perform corneal cross-linking. So that's a great tool. All you have to do is go there, hook it up, and it'll bring you right to their location. And so I want you guys to be able to use that as a tool. In addition, that same website has some cross-linking insurance guide. So an insurance guide, because these operations can cost quite a bit of money. If you don't have the resources for it, or you have some type of insurance that needs to cover it, and they're giving you a hard time. They're saying no, they're not going to cover it. Well, there's ways to kind of get around that, and both this one website as well as the National Keratoconus Foundation, if you've never seen their website, I'll again hook up the link in the description below, but they also have a good kind of easy-minded walkthrough of how dealing with insurance and even how to appeal against your insurance, because really, if your surgeon, if your eye care specialists say that you need this, then we want you to get it because it's going to be beneficial for you, not just now, but probably for the rest of your life. So again, that's a big one. I want everybody to kind of write down and take notes on it, to look up corneal cross-linking. Check out those links in the description below. Now, the next sort of treatment I wanted to discuss is called intracorneal ring segments. So intracorneal ring segments. So this is a really beautiful picture of what this looks like. This is actually a photo from a kind of an amateur photographer who had the procedure done, and it's beautiful. You can actually see what we're talking about. This is a plastic ring that's actually put into the cornea, and that actually causes the cornea to plateau out. It actually smooths out the cone of the surface of the eye, and that's really to help reduce advancing problems with myopia or nearsightedness, as well as really bad astigmatism. Because again, you're into the moderate and severe stages of keratoconus. Your astigmatism is so irregular that it causes problems with your vision, and it's difficult to get correction with glasses and contacts. So if intracorneal ring segments is something that is good for you, your surgeon, your eye care specialist will talk about that option. Now, another option, this is kind of getting more into people who have really mild keratoconus. If you have really mild or moderate keratoconus, the standard treatment is actually with glasses and contacts. Now we got a couple of contacts I'm just kind of showing here in the picture. The one on the right here is actually a soft contact lens for people with really mild keratoconus. You can still wear soft lenses and see very well. On the left side, we have a hard rigid gas permeable or RGP lens. Then RGP lenses actually work great because they mask a lot of the distortions of the surface of the eye from the keratoconus. There's actually specialty kind of hard lenses called Rose K. That's a brand that's been out for a long time. We have some of those in our clinic. I've fit those before in school, and some people prefer those over other treatments because they work so well. And what's nice is that hard lenses, a lot of people think, oh, RGP hard lenses are a thing of the past because soft lenses are so much better. Actually, there's this kind of swing going back in the eye care community because people are finding, oh, wait, hard lenses, I only have to buy them and they can last me more than a year. I can wear them for 4 years if my prescription stays stable, if I take good care of them. It's pretty amazing. I've had people even come in like 10 years. They've been wearing the same lens for 10 years. and they just take good care of them, and the prescription hasn't really changed, and they're seeing great. Now, I can't guarantee you'll ever have that stability with a hard lens, but they are excellent, and so a lot of people are kind of going back to those. Another kind of specialty lens, these are another lenses that I fit in the clinic too. These ones are called this is a specific brand called Duet. And again, I'm not sponsored by this company or anything, but they make this, it's actually a hard lens in the middle and then a soft skirt on the edge. And those lenses are more comfortable because they have the soft skirt around the edge. And then the hard lens in the center gives you better clarity. It actually helps you see better than you would with a standard soft lens. And it's very stable because you got the soft lens hold it in place. So there's a lot of advantages to kind of these hybrid contact lenses. There's another form too that I don't really have pictures of, but it's called piggybacking. That's where they have the soft lens and then they put the hard lens on top of the soft lens. That occasionally will work too, and you'll see some specialists prescribe that. Now, the next treatment that I want to go over is one that I'm really passionate about because I love it and I have such good success in the clinic from it. And it gets me it's one of the reasons why I became an eye doctor. I love seeing people and helping them, and they go from being frustrated with what's going on in their life, and all of a sudden, boom, they're seeing it. And I've had people cry in my office because they finally see 20/20, or they've just never seen as well as they have with this treatment. And this is called a scleral contact lens. So a lot of advanced treatments, even after surgeries on the eyes, scleral contacts is kind of a big growing part of the eye care community. So these are really large lenses. They are like almost double the size of a regular hard contact lens, and they actually work because they land and sit on the white part of the eye, the sclera. So your cornea's got all the nerves where you feel if you're dry or painful, but no, the scleral lens lands on the conjunctiva and the sclera on the white part of the eye, and it basically vaults over the cone. So there's no touching of the cornea at all, or there shouldn't be if it's fitting correctly. And so these scleral lenses are just, I love it because I get such good vision. Because it vaults over the cornea, you actually have a fluid layer trapped underneath it. It's kind of like a bowl filled with fluid, and it actually basically gets rid of that distortion caused by the irregular cornea, the keratoconus. So I can kind of show you what it looks like. This is just a cool little stress ball I got for an eyeball, and this is like a giant kind of demonstration contact lens. And basically it's like fitting that lens right over that. That's how big it looks on the eye. But again, with scleral lenses, it does take a lot more skill. Not every eye doctor knows how to fit scleral lenses. It's something that they kind of brush over in school. They do maybe one kind of workshop to actually see what it's like. So a lot of students who are going through it will have to choose electives to become more specialized, get hands-on training with scleral lenses. And then beyond that, once you have your degree, you have to choose, if you want to specialize in scleral contacts, you want some experience, you not only have to buy the fitting set, because you can't just order these based on theories or empirically fitting. You can't order them online or anything like that. You need to purchase it from a professional who knows how to fit them, because if they're not fit right, they can actually hurt and damage your eyes. So I actually went the extra mile. I've gone through actual programs and what are called wet labs, where you actually learn how to fit these properly, troubleshoot the issues. I've got books on it, and I fit these in my clinic. So now scleral lenses, again, if you're being fit for scleral lenses, takes a little bit longer, but once it gets set, like I just had a patient the other week come in who has seen like 3 or 4 different doctors, and they were not successful in getting her good vision. She was never happy in glasses, never happy in the contacts she had. She went through different surgeries, still was unsuccessful. So finally, she got referred over to my services, and it was amazing. Like seeing her basically she had that jaw drop moment. And that was one of the amazing things about my profession. And I absolutely love that. It lit me up for the entire week. Just how amazing, like I helped this person just to a huge degree. So again, I don't want you guys to I want people to be aware that this technology is out there. It's a great option for a lot of people. Now, if you're not sure, hey, does my doctor use scleral lenses? Do they fit scleral lenses? There are actually ways to find doctors with scleral lenses. Now, I don't have a slide for it, but I'll hook it up in a link in the description below. Again, there's another way through the Scleral Lenses Education Society where they just have a search engine that will show you what doctors have been certified in scleral lens fitting. And there's a couple other websites too, but you can also just call up your clinic and ask, hey, do you fit scleral lenses for keratoconus? Or do you just fit scleral lenses in general? Because we use them for more than just keratoconus. We use them for dry eyes because it holds the fluid to the eye. That's an amazing use for it. People who have surgery on the eyes, that things didn't go right, we can do it for that. People without keratoconus but have vision issues with really high levels of astigmatism that aren't pathological, they can sometimes be fit with a scleral lens, and it works excellent. So again, that's really good technology to know about. Now, the next kind of treatment option, which is more or less our last kind of treatment option I wanted to go over, is because the end stage of keratoconus, where treatments have been tried and it's progressed to a really far point where the eye has scarred. It's thinned so much that it's scarring, and that the eye is becoming painful from a condition called hydrops. That's actually where it's so thin that part of the cornea is actually bulging through, and it becomes extremely painful. Those people need a transplant, a corneal transplant, and we call that a keratoplasty. Now, I want to include an image. I tried my best to find the nicest image of an eye. If you have a brave soul and you want to kind of Google search your own images of what a keratoplasty, a corneal transplant, looks like, you can do that. But this was actually an amazing corneal transplant. The outcome, it looks great. There's 2 stitches left in the eye, but I'll tell you, whoever did this, the surgeon who did this, must have been very, very talented. It looks excellent. It is estimated that 10 to 20% of all keratoconus patients do need a transplant. But a recent publication actually found that 25% of all keratoplasties for keratoconus has gone down because of that corneal crosslinking. So we kind of went full circle. We kind of went through, okay, how is it treated? But we went all the way back to corneal crosslinking. That's how important crosslinking is to keratoconus treatment these days. But ultimately, having some sort of corneal transplant, for people with advancing keratoconus, they will have that. They'll have donor tissue. Basically, they'll have the cornea cut open, removed, they'll put donor tissue on the eye. And that's a great solution. It works well for some people, but it is an intensive surgery, and you're often on eye drops for basically the rest of your life. And often, on average, corneal transplants last only about 15 years. So people who get it when they're young, they often need multiple corneal transplants. And, just like any other transplant in the body, things can reject and it can become problems. But that's why you see doctors who know what they're doing. So yeah, for most part, guys, that's everything I wanted to kind of cover about keratoconus here today. I did want to kind of shout out to everybody here. If you have any other real big questions about keratoconus, please comment in the section below. I'd love to hear from you. I do want to have an eye health question of the day. Our eye health question of the day is, hey, in the video, what are your favorite treatment options? Have you been treated for keratoconus? And go ahead and comment in the section below. Share your story. What are your successes? What have you had struggle with? I want this to be a great kind of resource just to kind of really help other people who are maybe struggling with keratoconus. Otherwise, guys, this is great. Thank you so much for joining us. If you like this information, give me a big thumbs up and subscribe to the channel if you're new. Again, I'm Dr. Joseph Allen here from Dr. Eye Health, the channel that helps you with the eyes, vision, and finding the best vision products. Otherwise, please check out for other cool videos. We do have another cool video up here to the side, as well as another video down here. You can click or tap the screen over here to the side. Thank you guys so much for joining us, and we'll keep an eye on it. We'll talk to you soon.